You're watching a production of South Dakota Public Broadcasting.
Welcome to Contours, conversations about issues in agriculture that impact us all. Contours is produced by the South Dakota State University College of Agriculture and Biological Sciences and SDSU Extension. These programs are distributed online through igrow.org.
Hello, this is Contours, as we continue to talk about important topics in agriculture in an open conversation with South Dakota's agriculture leaders and you. I'm Dr. Barry Dunn, Dean of the College of Agriculture and Biological Sciences here at SDSU. In this edition of Contours, we're going to talk about animal health. Healthy animals are an important factor in providing safer food. Just like people, animals can get sick and may require medicines to treat their conditions. More importantly, animal medicines are a critical link in the food safety chain. Modern livestock production involves a team of people committed to the animal's health with the goal of creating wholesome, high-quality food for consumers. Here are some of the challenges animal agriculture faces. The pets that people have in their homes have changed the way people see all animals and the ways that animals are treated and used. Consumers' understanding of where their food comes from and how it's produced often stops at the grocery store. And there's the issue of the animal-human interface, as many groups of humans come into contact with animals on a regular basis, whether it's through animal agriculture, pets, or hobby animals. The issues of biosecurity as standard health practices are important to consider. To provide some insight, answers, and reassurance about these issues, we have four people who are intimately involved in animal health in South Dakota. Dr. Dustin Oedekoven is the state veterinarian for South Dakota. Dr. Russ Daly is professor at SDSU and SDSU Extension veterinarian and our state public health veterinarian. Dr. Kightlinger is the state epidemiologist for South Dakota. And Hannah Wakas is president of Pipestone Veterinary Services. Animals and humans get sick from time to time, and just as we need doctors to take care of our ailments, animals need their doctors too. For example, FDA-approved medicines like antibiotics are used to treat sick animals under the supervision of licensed veterinarians. But what happens to the meat or the milk from that animal after it's treated? It's one of the issues that has consumers seeking reassurance about their food supply. So our first question, I'd like to turn to Russ and to Hannah to talk about the producers that you work with every day and how you see them treating their animals as part of the food system and what you've noticed about the stewardship and care that they take of them. So Dr. Daly, do you want to lead off?
Yeah, I'll start. You know, I've been a veterinarian here in South Dakota for 25 years, and when I think back to when I started out and the way things are now as far as what I see happening on farms and operations, you know, back then it seemed like we were always looking for a solution in a bottle. You know, you talked about antibiotics, and we talk a lot about antibiotics now, but that seemed to be the focus. And when I look back and compare it to today it seems like we can come up with a lot of different examples about how we're managing animal health in ways that preclude our use of drugs or having to go in after the fire is burned, so to speak. So I'm talking about things like stress reduction, learning how animals respond to stress, what can we do to decrease transport stress, environmental stress, those kind of things. If we do that, we can keep animals healthy in the first place. Simple things like understanding disease pressures and where animals pick up germs. We can preclude a lot of their illnesses by just moving cows, through what we call the Sandhills cattle system, moving pregnant cows onto clean ground where their calves can have a clean place to be born. Things like that where we're thinking about animal health and prevention instead of just looking for a solution in a bottle.
Yeah.
I would echo Dr. Daly's comments. He makes a lot of very, very valid points. And the other thing that I would say is my earliest memories were having a 5-gallon bucket that I would carry outside in the spring of the year once the ground had thawed and picked up all of the piglets that had froze to death over the winter. Oh. And back then, that's just how we raised animals. We know so much more now, and we take better care of our animals now than we ever have because we build state-of-the-art buildings to keep them in. They are sheltered from the elements that we all go through in South Dakota winters. When it's negative 10 degrees outside, it's a nice toasty 70 degrees inside for those animals. When we go through the heat of the summer, it's nice and cool in those facilities for those animals. We keep them in facilities that sometimes are more technologically advanced than the homes that we live in. And we truly have been able to utilize technology to provide better care to those animals in just the facilities we keep them in, as well as some of the veterinary oversight that we've been able to do. We've definitely leaned very heavily on biosecurity in recent years. And all biosecurity is anything that we do to try to keep diseases out, whether that's taking showers before we go into the barn to make sure that we're not carrying diseases on our body or on our clothes, whether it's staying out of the pig barns when we have a cold so we don't get the pigs sick, whether it's making sure that we're not having visitors come onto the farm because they could potentially bring diseases with them. There's lots of things that we can do to really be proactive and not be the fire engine calls, as Russ called it.
Yeah.
I think we've seen a lot of participation by producers in voluntary programs such as the Beef Quality Assurance Program, the Pork Quality Assurance Program, other industry-based standards that producers have met. They go through those programs, they learn about some of the management techniques that have been discussed here, and make plans to address issues before they become real problems on the farm. And so those have been very successful programs, and I think have led to a change in thinking about how we manage animals on farm.
Lon, I have a question for you. You're our state epidemiologist, and we see your name in the paper a lot, and as this frontline person to help us with disease. But help us, what is an epidemiologist? What is epidemiology as a science, and how does that relate to our food supply?
Well, epidemiology is just, I guess technically the word means one who studied disease. So what we do is we collect data, we monitor the diseases that are occurring in people in South Dakota, see patterns, where they're coming from, who's infected, try and stop the transmission to other people, and then most important, try and prevent people from getting the disease. So we try and work upstream as much as possible, but we do spend a lot of time working outbreaks and people that do have some type of an infectious disease.
So Dusty, how does your office work with Lon's office to protect our citizens of our state in disease outbreaks that might cross over and maybe pick up on what is a zoonotic disease? We hear about these terms. Help us understand that a little bit. Sure.
Well, I and the other staff veterinarians for the Animal Industry Board also employ epidemiologic principles where we are studying disease, trying to understand the various ways that diseases are transmitted, and for some diseases that are either have a high economic consequence, as we've seen with highly pathogenic avian influenza or porcine epidemic diarrhea virus, which was introduced here in the United States and in South Dakota in 2013. It's very important that we understand the transmission of those viruses and other pathogens so that we can assist the livestock industries in preventing the spread of that to other livestock populations. But we also work closely, as you mentioned, with the health department in controlling zoonotic diseases, and zoonotic diseases are those that can be transmitted in between humans and animals, both directions. And so one of the major zoonotic diseases, of course, that we're continually concerned about is rabies, which is a virus. And we do have what we call a reservoir of disease in South Dakota in the skunk population. And so we work very closely with the health department on monitoring animals that might have symptoms for rabies, and of course with the veterinary community that's out there. So that's one example. Of course, there are many other zoonotic diseases. In fact, a large percentage of the diseases that are of concern to human health may also have a zoonotic component.
So when as a citizen, as a community member, we hear about a zoonotic disease like influenza. So we have, so as I read the paper, I hear about dog flu and bird flu, and then of course, and we know about human flu. Lon, how do these interact, and what should we know about this flu disease that we hear so much about in China, but also now in South Dakota and with dogs? What's going on?
Yeah, it's a big topic, and most diseases are just human-to-human diseases. They're solely in the human population. When we breathe on each other, or when we cough on each other, or when we kiss each other, influenza can be spread. But ultimately, the flu that we're dealing with now in the United States and in South Dakota that hits us every year, way back when, that originated in a bird, in some waterfowl somewhere. And every so often, about every 40 years or so, a new virus emerges, and that's what we call a pandemic. We had that happen back in 2009. A new type of a virus came out. Nobody had immunity to it. It was called for a time swine flu. Now we just call it H1N1, which is probably a more complicated name, but that's what the name is. And all these influenzas, they start in some wild bird population someplace. They end up in some mixing bowl animal, which is often a pig, oftentimes in East Asia or China or Southeast Asia, where people live in close contact with birds and pigs and people living in very close quarters. The virus mutates, gains attributes that make it transmissible human to human, and then pow, off we go, a new virus, and it doesn't take long. We saw that in 2009. It doesn't take long to make its way all across the world and make a lot of people sick and kill a lot of people.
So is the world, as we think about travel and commerce, is it a different world that we face today as you folks deal with disease than it was 40 years ago or 100 years ago?
Absolutely, absolutely it is. I can be, and I have been in China yesterday morning, and by this evening, I'm back in South Dakota. I may have been exposed in the airport or in the hotel or someplace. Somebody may have coughed on me, exposed me. It takes about 48 hours to incubate. I'm back home in Pierre. I get a fever, I get sick. I've got this new virus from China. It's just impossible, really, without just completely stopping transmission. Or like Ebola. A West African disease, and here in South Dakota, we monitored every person that came from the Ebola countries. We monitored people for 21 days until they were finished with the whole incubation period. We checked their temperature twice a day to make sure they weren't going to come down with Ebola.
There are a number of diseases worldwide that that would fit what Dr. Kightlinger is talking about. We've seen in the last several years a new coronavirus that seems to be circulating among camels and people in the Middle East, and we've had cases of that in the United States. People who have traveled to those to foreign lands, and so we have that constant threat with people traveling. But there's also products that are traveling, and one thing we saw with the porcine epidemic diarrhea virus, which was a very deadly virus to the young piglet population. This was a virus that was not known to be in the United States prior to 2013, and when it was found here, it was found to be very, it took hold very rapidly and became very widespread among the pig population because our population of pigs in the United States did not have immunity built up to that virus. And as the epidemiologic studies were wrapped up on that, it was most likely that that virus was brought in from some transportation bags on ships from China. And so sometimes it's not very obvious where, or how a virus might have emerged into the United States or been introduced into the United States. But there are a number of threats out there that bear constant watching.
I'd like to make the point that we have, in South Dakota anyway, we have a health department that's taking care of these human emerging issues. We have an animal industry board, a state veterinarian's office that is really on top of all these emerging animal disease issues. And as we've mentioned, there's connections. And our two state agencies in that regard work really well together. And that's not something we see everywhere. And that's going to be just more important as time goes on, that we work together. And I'd even extend those down to, the producer in the hog barn, or the mother taking care of a kid that's got something popping up that's unusual. It's important that everybody along that continuum be able to report, these things to your office, to Lon's office, and that coordination takes place at that state level. We really are more so than ever in need of the infrastructure of education, so our producers know when to call in somebody. They know when to consult a veterinarian, that the veterinarians have a good relationship with the diagnostic labs and the state agencies to get on top of these things. It's more important than ever because of all of these new emerging things that pop up.
One of the things that I guess I'm interested in agriculture clearly, but I'm actually quite proud of, is that even with these emerging diseases and these health challenges of this modern world, levels of productivity of food animals, Hannah, has really almost skyrocketed in terms of producing safe, wholesome, and relatively inexpensive food for the American consumer. So I think it's interesting that while we have these challenges, I think we've done a pretty good job at handling them, which because we see these great levels of productivity. And I know in your system and the farms you work with, you've seen an enormous actual increase in productivity.
Correct, and we attribute a lot of that just to animal care. People working very closely with their veterinarian and improving the quality of care that they're giving the animals. That's at unseen levels. It's phenomenal. It makes me proud as a person working with these family farms to see the level of care they bring every day. The other thing that I would say is it's also very impressive that we're able to produce about twice as much product, or twice as much protein on half as much natural resources as what we used to 50 years ago. So our carbon footprint is shrinking greatly, and we are producing more food for the world at the same time, which is a great thing, because as we look to have the human population increase the way it is, it's phenomenal that I'm confident that we will continue to be able to feed the world and do it at a very, very high and healthy level.
But Hannah, pick up on that. As that consumer walks to that meat case or walks to the dairy case and looks at cottage cheese, milk, or a poultry product or a meat product, what do you want them to know about the safety of that food, especially in relationship to this antibiotic issue that we hear so much about?
Well, I'm glad that you brought that up, Dr. Dunn. That is very confusing. I work with it every day, and I go to the meat counter and I'm still confused. And so I feel for the mothers and the fathers that go out shopping for their families, because it is overwhelming. And the big take homes that I give my friends and family when they ask me those questions is, number one, there are no antibiotics that are allowed to be used in pork. And so all pork is hormones. So all pork is hormone free. So anytime you see hormone free marketed product, it's all that way, because it's not allowed to be used. From an antibiotic level, just like when my kids are sick, I take them to the doctor and I get antibiotics to help make them better. We do the same thing with our veterinarians. Producers call a veterinarian when their animals are sick to have that veterinarian come out and make them better. We then follow a very rigorous withdrawal process to make sure that there is no residue of that antibiotic in that meat before it is harvested. And so rest assured, you can be confident that the meat that you would buy at the grocery store or anywhere is completely antibiotic free. As a mother of young children, that's equally important to me. And that's equally important to me to know that I have confidence in the food that I'm providing to my family.
Russ, how about the dairy industry? We've seen a growth in the dairy industry in South Dakota. We hear a lot of talk about feed additives in the dairy industry. What do you see not only from that side of it, but also that productivity side? You're on the ground with these guys all the time.
It mirrors what Hannah was saying about the pork industry. Productivity has skyrocketed. You know, when I talk to dairy producers, and back to my old experiences as a vet in southeast South Dakota, treating mastitis cows, you know, boy, to talk to a dairy producer now, they just don't spend a lot of time doing that individual animal, the need to treat those individual animals with something like antibiotics, because so many advances have been made as far as preventive medicine, how to keep those animals healthy in the first place. Nutrition, stress relief has decreased those levels of conditions where we would need to treat those animals. So it has really mirrored what we've seen in the other industries as well, and that's allowed our dairy industry to really become more robust with every passing year here in South Dakota.
Yeah, Dr. Dunn, I think it's important to recognize, as you mentioned, that the status of animal health in our country is at an all-time high. I mean, we really have a finely tuned production system which has yielded you know, a lot of safe, consistent food supply for our country, not only the people in our country, but other countries that we export to. And antibiotics are used on occasion when necessary. And we've seen some attempt by some in Congress to completely remove antibiotics from production animal medicine. And that really is not a viable answer. Because while antibiotics are not used all the time, they are occasionally used for disease prevention, control, and treatment of disease, and they are a necessary tool in some cases. But I think what's really important for the consumer to recognize is that there are safeguards in place to ensure that the label directions on those antibiotics are being followed, so that the end product, whether it be milk or meat, is all antibiotic free. It doesn't need a label to be antibiotic free to not contain antibiotics, and there are inspections and routine surveillance to ensure that antibiotic residues are not present in that food product that we're consuming.
Lon, I'm going to ask back to the flu question, because it hit the press last year. So I can get flu, my children used to get the flu, but what assurance can you give the public about this interface between human flu and the avian influenza flu that we talked about last spring so much? How do we work through this and understand this as a consumer?
Oh gosh, you know, it's really hard to give assurances to something that deals with the influenza virus. It's a very tricky, a very clever virus. It's always evolving. The only assurance that we can give people is we're monitoring the heck out of it. We have sentinel clinics across South Dakota, as does every state. We're checking the virus constantly to see if it's changing or evolving, and looking to see if a new one hits. Last year when we had the avian influenza outbreaks in South Dakota, we were monitoring people that were working with those viruses to see that the bird flu didn't make people sick. So we're on the lookout for it, but our enemy is formidable. That flu virus, you've got to respect that. It could be the end of us. You know, some of these pandemics, we had one almost 100 years ago in 1918, and it killed 40 million people. And even though we've got, you know, way more advanced technology and methods, that virus, it's something to be reckoned with. And I'm not putting my money on the people, but boy, you know, we've got to be ready for it.
From the animal health side of things and food safety, the Animal Industry Board is in partnership with the poultry industry in our state to monitor every lot of turkeys, for example, which is the main poultry product in South Dakota, to ensure that, that they do not have avian influenza prior to going to slaughter. Even so, we know that poultry is not a risk, a food safety risk for avian influenza. We're primarily concerned about the potential economic impact to the poultry industry, and so for that reason we're involved in surveillance programs to monitor for that virus on every lot that goes to slaughter.
Well, it's certainly been a great discussion. I appreciate your time. We hope this has informed and reassured you about some of the key issues in animal health. If you'd like to learn more, check out our iGrow website, igrow.org, and click on the livestock section. We've also set up some links on our website that will connect you to more information from the State Veterinarian and the South Dakota Department of Agriculture. I'd like to thank our guests today for providing insight, information, and inspiration. So thank you, Dr. Dusty Oedekoven, Dr. Russ Daly, Dr. Lon Kightlinger, and Hannah Walkus. That's all the time we have for this portion of the animal health episode of Contours. This edition looked at animal health from a consumer perspective. Our next show will continue to talk about animal health and examine the issues that face livestock producers in South Dakota. Thank you for joining us for this edition of Contours.
Contours is a conversation about issues in agriculture that impact us all. These programs are produced by the South Dakota State University College of Agriculture and Biological Sciences and SDSU Extension. You can watch these programs on your local South Dakota Public Broadcasting station or by going online to igrow.org.